and welcome to episode 7 of the Fat Doctor podcast, season 5, I should say, because there's been more than 7 in total. I'm your host, Dr. Ashalami, and it's been 30 days since Trump took office. That's 30 very long days, a month, in fact. Gotta say, I'd rather be fat than a fascist. Saw that on a post the other day and thought, yeah, I'm claiming that one for myself. I'd rather be fat than a fascist. I'd rather be fat than most things. Today, I'm going to tell you all about Harper. Harper is a fictional character that I created, an amalgamation of sorts of many, many, many Harpers that I've met over the years in my illustrious medical career. 20 years of clinical practice for those who are wondering. And yeah, I've met a lot of Harpers, and I'm not going to lie, I have fucked up more often than I'd like to remember. I've harmed a lot of Harpers in my lifetime, and I'm trying to make amends for that today with my post. Um, Harper is going to use, we're going to use they, them pronouns for Harper, just so that, you can imagine them exactly the way you want to. They could be a girl or a boy, a woman, a man, non-binary, everything in between. You don't have to, I'm not going to describe them in any way other than to say their name is Harper. They are 33 years old. And they've been experiencing widespread body pain since their mid-20s. Harper works as a graphic designer. Feels like a very cool job. But it does mean long hours at a desk, right? Lots of hunching over a computer, kind of like I do nowadays. And, to be honest, they initially just dismissed their pain as, positional, just been sitting too much, hunched over my computer, or need to get more exercise, need to get out more, things like that. The usual, because that's what we're told, isn't it? That, it's pain, it's something you've done wrong. It's obviously your fault. Um, but, in addition to the pain, Harper's been experiencing quite significant fatigue. Like there's being tired, and then there's being exhausted, and Harper was experiencing the latter. Brain fog, and everyone kind of like says, "Oh, it's like you're 20 years older than you are, love. What's going on? Why are you struggling so much already? In your prime of your life, why are you so exhausted all the time?" Which is a very good point. And Harper finally decides that they're going to go and visit a doctor. Yeah, they stay away from the doctor in general because they're fat, and fat people don't go to the doctor unless they absolutely need to. Why? Because they know they're in for a lecture about weight, especially when you've got these kind of symptoms like pain that's widespread and fatigue and brain fog. You just know it's going to be blamed on the fact that you eat too much, don't do enough exercise, you need to lose some weight, and stop being so stressed out. Try and manage your mood as well. Probably chances are you're a bit depressed because you're fat, fat equals depressed. And so we avoid the GP, we avoid the doctor, until we can't any longer, and then we go. And so Harper goes to visit the doctor for the first time at the age of 28. Remember, they're 33 now, right? So it's quite a while ago. Goes to the doctor, and lo and behold, they were right. What does the doctor say? Lose weight and exercise more, because that's easy. Didn't do an examination, didn't do any blood tests, didn't do anything really, just listened for a few minutes, typing away on the computer. And my favourite bit is like the patient stops talking and the doctor's still typing. And then there's this really awkward silence where the patient very obediently waits for the doctor to stop typing. It's just so bloody rude. You've come here to have a conversation, and the doctor isn't even looking at you. They're looking at their computer, writing their notes, and their notes have to be very thorough. And to be fair, our notes have to be very thorough because we are likely to get sued several times during our career, and the only thing that will save us in this terrible lawsuit is to have good notes. So they are important, but they shouldn't. This kind of fear of being sued, this litigious kind of society that we live in, should not trump patient comfort and patient safety and things like that. But anyway, I digress. The doctor's typing and then eventually prints out or hands over a leaflet about healthy eating. Just try and eat more healthy and exercise. They didn't ask any questions. about Harper's exercise or diet. I mean, that would that would take time that they don't really want to spend. But they gave a lecture, well, you really need to eat less and exercise more and stop eating sugar because you're addicted, and stop eating fat because that's very bad for you. Just eat vegetables and lean proteins. And here you are, have a leaflet, off you go, and you'll feel better. And Harper's 28 years old when that happens, and they go away and they, chances are attempt it at least once or twice, because it's not like they've not been on a diet before, and it's not like they're not going to go on a diet again. So yes, of course, they eat less and they exercise more, and they find that makes it worse, not better. Pain's worse, and they're not able to maintain that weight loss for great lengths of time. And so that's it. What's the point? I knew it was a waste of time to visit my doctor. I did it anyway, and now I massively regret it. Um, we move on now. Harper is going to turn is going to turn 30 before they go and see a doctor again. Um, and this time round, they're a little bit more firm. I've tried the diet, it didn't help. It's been 2 years, it's still going on. And the doctor thinks, yeah, we probably ought to do something. It's been 2 years. So they do some blood tests, just your routine screening ones. And blood tests come back normal. And the doctor says, well, nothing to see here. Everything looks fine. I imagine it's just depression. You've got low energy, and you've got pain everywhere, and we know that's more common with depression, and just you're probably depressed. That's probably all it is. And if you have pain and fatigue for 2 years, you'd be depressed too. You would, because chronic pain infringes on every part of your life. Your life becomes smaller. I've talked about this already. You begin to contract in on yourself. You're less able to do things for yourself. You're less likely to be sociable. You just want to stay in and protect yourself. And it's pretty freaking miserable. So yeah, duh, of course, Harper's depressed by now. But that wasn't really the underlying problem. I mean, it's to be expected, but it just feels a little bit too easy, a little bit too suspiciously easy to just blame it all on depression. But, Harper is feeling a bit crappy and is at this point in time willing to take anything to make it better. So prescribed an antidepressant, a selective serotonin reuptake inhibitor. So not one that's specifically prescribed for pain, but just a standard, bog standard antidepressant. Take an antidepressant, you'll feel better. And obviously, even though they're having the depression consultation, there needs to be a little bit of weight stigma in the consultation. You can't just have an entire consultation with not without bashing somebody over the head about their weight. So there was mention of, oh, well, that weight is really putting extra stress on the joints. And that's no wonder you're in pain, depressed and heavy. Of course, you're going to have pain. So that's another thing that Harper has to live with now. I'm depressed, I'm fat, I'm lazy, and my weight is putting stress on my joints, and that implies that it's never going to get better, right? If your weight is like the cause of all your root problems, and then you're just not ever going to get better unless you become thinner, which is something you've been trying for years and years and has never happened up until now. So what are the chances it will in the future? But, Harper's a trooper, does their best, takes the antidepressants, feels a little bit better, a little bit, not significantly, goes on another diet, gonna do it this time, and I crush it this time, is like, this is the one, and is really, really, really putting their heart and soul into it. They've got a bit more energy because they're on the SSRI, so they're hitting the gym 4 times a week, and they're, even though it hurts, they're like, no pain, no gain, woohoo, and counting and tracking, got one of those apps on their phone, the usual. And a year later, Harper's back at the doctor again, because none of it's worked. If anything, it's worse again. So this is doctor number 3, and doctor number 3 actually bothers to do an examination, which makes them better than doctor number 1, doctor number 2. And Harper is so impressed by the fact that this doctor has actually bothered to examine them that they almost misinterpret the consultation as a good one, a positive one. This is actually a good consultation. Look, the doctor cares about me. He's actually willing to examine me. I'd just like to point out that doctors should be examining their patients as standard. It's not a bonus, right? It's not a freebie. It's not like, ooh, how generous, buy one, get one free. No, That's what they're supposed to be doing. But the doctor did a proper examination and this time round did a full set of bloods and ordered an X-ray. Ordered an X-ray of both of Harper's knees, which were particularly problematic at the time. Both knees got X-rayed. Well, you know, bit odd. Harper's 31, chances of having arthritis, especially with no history of injury, unlikely. But the doctor did an X-ray, and so Harper's feeling good. Someone's paying attention. In my opinion, that's probably not what I would have done. But they tried, and it's better than nothing. However, this doctor is still focused on weight. They're still talking about pressure on the joints. They're still talking about inflammation from all that extra fat you've got lying around. They're still talking about weight as if it's a problem that needs to be solved in order for the pain and the fatigue to go away. So, I mean, I'm not sure it's a perfect consultation. But this doctor refers Harper to a specialist, to a rheumatologist in this case. And it's the first time that a doctor has said, actually, why don't we send you to a specialist that might have a better idea of what's going on with all of your joints because it's a widespread pain. Takes a while, doesn't it? Because seeing a specialist isn't something that happens very easily. I used to think that, in the US, um, one of the benefits of not having a healthcare that's free at the point of contact and waiting lists are at least 6 months for a specialist. I used to think like, oh, in the US, like you just go the next week, easy peasy, just pop in the next week. And that doesn't seem to be happening with any of my clients in the US, so that's quite odd. I was under the impression, especially from the television, I was under the impression that like you get diagnosed with a condition, they're like, you need surgery, I'll book you in for next week. In the UK, you need surgery. I'll book you in for next year, tentatively. Chances are it'll get cancelled at least 3 times. So we're looking at 18 months. But no, I just assumed that, you get in the next week. Apparently that's not the case. It's come as a real surprise to me. But anyway, if you're listening from the US, you're probably laughing at me right now. Um, Harper finally gets to see the rheumatologist. They've turned 32. This started, first doctor, they were 28. They've turned 32. It's been 4 years. Not quite, but almost 4 years. Terrible stuff. So what does the rheumatologist do? Anything different? Well, they do a history and an examination, and Harper repeats the same things they've told the previous doctors, this time in a little bit more detail because it's a specialist. And then the doctor says, I'm going to do some blood work. And Harper's thinking, I've already had blood work done and nothing came up. But all right, fine. You want to do my third lot of blood work, you do it. And I tell you, rheumatologists don't fuck about. They order every blood test under the sun. It's quite impressive, actually, the number of bloods they will order. Because, yeah, they're looking at all these different autoantibodies and stuff. Like, fair enough. So they go. You can see how I'm visualizing Harper now because I've given it away. But they go to get their bloods done, and they take like 14 vials of blood. It feels like they've just given a pint away, but it goes off to the lab and at least this rheumatologist does something called pain mapping, which is when they actually basically it's very, very simple. Child could do it. It's like a picture of a body, and then they shade all the areas that are in pain. So at least they've bothered to do that. And maybe they did the WPI, the widespread pain index, and just calculated that. The symptom severity score, maybe they did a bit of that as well. So at least they're doing something. They're looking at diagnostic criteria, etc., etc. Harper goes away, comes back 3 months later, because it's usually a 3-month follow-up, isn't it? And on the second visit with the rheumatologist, there was finally a diagnosis. Finally, a diagnosis of fibromyalgia. And it was presented to this, good news! We can't find anything wrong with your blood tests. All is well. You've just got fibromyalgia. Just. Here's the name of your condition. Off you go. Don't need to see you again. It's not a rheumatological problem. So whose problem is it? Goes back to see the GP. It's not the GP's problem. All right. Well, who's going to be managing who's in charge of fibromyalgia? Well, it appears that nobody is. I would argue possibly a pain specialist, but I don't know. Some people with fibro have a pain specialist. Some people are just looked after by primary care. And if you've got a decent primary care physician that knows what they're talking about, that's probably sufficient. But the problem is most doctors don't have a fucking clue what to do with patients with fibromyalgia. Some doctors don't believe it's a real condition. They put it in the same box as they put IBS, irritable bowel syndrome, and chronic fatigue syndrome. Oh, those are made up conditions, not real. They're very much real. Those of you who are watching me on YouTube, you can see my face. They're real. They are not made up. And anybody who dares to say that in front of me is going to get their head bitten off. But yes, a lot of doctors don't even believe the diagnosis, or they just don't think it's an important diagnosis. Well, there's not anything pathologically wrong. There's not, the bloods were all normal, so it's not a real big deal. What's the problem? Like, we don't have to worry. It's not cancerous. It's not pre-cancerous. It's not. You're not going to die from it. Just off you go. Um, and so there are a lot of challenges for people, even when you have the diagnosis. It took 4 years to get it. Finally get a diagnosis, no real explanation as to what is going on. Discharge from the rheumatologist, you're no longer my problem. GP who's a bit like, I don't think it's my problem, possibly referred to a pain clinic, again, who are a bit like, well, yes, you have fibromyalgia, here's some pills. But nobody's really taken the time to explain to Harper what's going on. Explaining how to manage the condition, and that actually there are lots of options for management, and it's complicated, by the way, and we need to, and it's individualized also, because no two patients with fibromyalgia are ever the same. But that's not that, the reality is that people with chronic pain, especially chronic widespread pain, whether it's fibromyalgia, which is the most common form of chronic widespread pain, or whether it's something else that's causing the chronic pain, then they face a lot of challenges. And that is especially the case if they have one or more marginalized identities. So if they exist in a fat body, a trans body, a queer body, a disabled body, a black body, an indigenous body, you know what I'm talking about, right? You're going to get it even worse, because as a lot of my clients, my patients with fibromyalgia say, oh, they're just going to blame it on this, they're just going to blame it on that. And when it comes to weight, oh, well, it's just because you're heavy. If you weren't heavy, your fibromyalgia would be better. And if it's because you're disabled, it's because you're too lazy. And if it's, if it's because you have a mental health disability, related disability, oh, it's all in the head. And if it's because you're black, it's because you don't feel the same kind of pain as white people. And if it's because you're neurodivergent, it's because you're not quote unquote normal, you're quirky. And if it's because you're trans, it's because you hate your body, and it's so on and so forth. Like, there's always an excuse, a reason to dismiss, to distract, to push, to blame the individual, and to allow the doctor to get away with doing very little. That's the experience of people in marginalized bodies. And so when it comes to chronic pain, there's the weight stigma when seeking pain management. That's a really big problem. Doctors are far less likely to treat their fat patients. And so when you need pain management, they're less likely to give it to you. And again, I mean, we know about the studies of the way that doctors treat black patients when it comes to pain. They give fewer painkillers. And that's I mean, there is a wealth of evidence that supports that, not just historically. Today, in today's modern medical establishments, we are denying black people proper pain relief, because we have been instilled to believe, or conditioned to believe, that they feel pain differently. Yeah. And so, although there are fewer studies to show this when it comes to pain, the same goes for fat people. GPs, primary care physicians, in fact, a lot of doctors are just not clued up. They don't really know much about this condition. They don't know what's causing it to start with. And they don't know, they don't understand it enough to be able to treat it. So patients with these conditions are constantly having to advocate for themselves, constantly having to do the research at home, ask around, find out, do the study. People should, I'm sorry, I hate reading medical journals. I wouldn't wish them on my worst enemy. I certainly don't want a person who's in pain to have to read a freaking medical journal so that they can go to their doctor prepared with enough evidence to prove that they deserve treatment. I mean, that's nonsense. That's not your job. So yeah, it's very problematic. Even when you're sent to a pain clinic, your pain is often not managed properly. All the clients I'm working with now who are under the care of a pain clinic are in a lot of pain, which baffles me, because if you are at a pain clinic, their only job is to manage your pain, and yet they're not doing it. They're just not doing it, which is shocking to me. And then, as I said, there are the doctors who are constantly blaming every symptom you now get on your fibro. So it kind of works both ways. You're not getting the fibro diagnosis, and then you get the diagnosis, and then everything you get from now onwards, it's fibro. Well, hang on a minute. I just injured myself. Couldn't it be an injury? No, it's fibro. It's all it's fibro. I'm feeling really unwell at the moment. Oh, yes, your fibro. Is it? Or could it be something else? And so that is like that's also a big problem. Just no longer having like nothing ever exists now aside from this big diagnosis in capital letters at the top of your medical notes. How's fibromyalgia? Well, that's easy. I can now blame everything on that condition. Um, this is traumatic. As I'm talking about it, as I'm sure many of you, as you're listening to it, you're like, yeah, that sounds very familiar. And these encounters you have with healthcare professionals every time, that is a bit of trauma that you have to then carry around. And it's accumulating over time. It's like a bag that you're carrying. And every time you see a healthcare professional, you add more shit into the bag. It is a bag of shit. And some of us have been carrying around this bag for decades, and it is full of shit. See a doctor, have some more trauma. See another doctor, have some trauma. See a nurse, see a physical therapist. Trauma, 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 trauma. And it's accumulating, and there's no means of dealing with this trauma. You're not even allowed to talk about it. Don't say anything bad about the doctor. You're not even allowed to speak badly about the doctor. And so you're just carrying around this bag of trauma or shit, whichever way you want to look at it, and you're just lugging it around with you everywhere you go. And you feel that trauma in your body. Those of you who've experienced this, every time you go and see a doctor, I bet you have a feeling, a sense of something, a real physical sense that you experience every time you go to the doctor. I bet you're feeling it in your body, wherever it is. And that feeling, that is a sign of trauma. That is post traumatic stress. Every time you find yourself in a similar situation, or even just thinking about the situation, in other words, being in within a mile of a healthcare professional, you begin to feel the impact of this trauma in your body, and it rises up through the body and up into the brain, into the mind, where it just plays on repeats. It just plays on repeat, loop after loop after loop. These horrible consultations you have, the words that were spoken over you, the looks of disgust, the sighs of exasperation, all of those things. Like you're carrying them in your bag and they're just running around freely, taking up space rent free in your mind, all because you never had the opportunity to deal with this trauma. And that's not okay. There shouldn't be trauma associated with going to the doctor. This is not the same as trauma that you experience during an accident or during a serious illness, which is a different type of trauma. If you suddenly become unwell and you end up in ICU or something, that is in of itself trauma. Being in ICU can lead to psychosis. It is a very traumatic event, but that's not the trauma I'm talking about here. I am talking about the emotional abuse that we experience at the hands of doctors. That's what I'm talking about. I'm talking about the gaslighting. I'm talking about sometimes the physical abuse that we experience at the hands of doctors as well. The assault, the assault. Every time you don't consent to something and they do it everywhere anyway, that's assault. I was talking to someone the other day, not the first person who's told me about this, of a doctor that was weight shaming them, even though they had specifically said, I don't want to talk about my weight, but they were weight shaming them whilst doing a pap smear. In the process of doing that, when they get the brush and they're like around your cervix, it's not pleasant. Nobody likes that. That's when they chose. Legs spread in the stirrups, wide open, that disgustingly painful, long plastic speculum that they've shoved in without much, without any foreplay, and then opened up, so flapped open, and now they're having a look around, they're scrubbing away, and that's the moment they chose to say, hey, you're fat, you need to lose weight, have you considered bariatric surgery? That is not the first person who's told me of this experience. This is a common thing. That is assault. If you said I don't want to discuss my weight and they talk to you about your weight anyway, it's assault. And when you're being verbally assaulted during a pap smear, be an intimate examination that involves a part of you that is associated with other sorts of assault, wires get crossed, and that is an extremely dangerous thing to do. So yeah, went on a little bit of a detour there about trauma. And I've run out of water. That's terrible stuff. It's a sign I need to stop talking. Um, and look, it goes beyond healthcare, right? If you've got fibro, you've got chronic pain and chronic fatigue, that's going to impact your work. That's going to impact your ability to socialize. It's going to make you more isolated. When you have a flare up, what do you do? If you can't take time off work, what do you do? When you're struggling to do the most basic of tasks and you need to rely on other people, what do you do? Like that in of itself is problematic. That's why, people who are fighting for disability justice, they're not just making these things up, being disabled sucks. And so people with fibromyalgia are disabled. Sucks. Now, I wanted to end with a little bit of positivity for poor Harper. And for any of the Harpers out there that are going, oh, that's me, that's happening to me, what do I do? Well, first of all, I want you to know that fibromyalgia affects 5% of the global population. 5%, that is a lot of people. All right, 5% of the global population. And I would like to point out that it is people with ovaries. Just putting it out there. It's more common in people with ovaries, especially people with ovaries. The average age of diagnosis, I believe, is between 30 and 35. So there you go. That's why nobody cares about it. What's happening is your nervous system, right, has like a volume control for pain. And in people with fibromyalgia, this volume control gets turned up. It's stuck on high volume, stuck, frozen. The only thing you can do is turn turn it off, and that's when we can't turn it off. Like we can't turn the brain and spinal cord off. So there is nothing we can do about the fact that it's stuck on high volume. We don't know why this happens. We have a few ideas and theories and hypotheses, but nobody really knows why the volume control is turned up, but it is. So what that means is normal sensations become painful. And the technical term for this is allodynia or allodynia. I think it's DYN. It's DYN, so I think it's allodynia. But that basically means a normal sensation that's become painful. And even very light pressure can cause discomfort. And that's called hyperalgesia. I just thought I'd put the medical names in there so that I sounded a bit more profesh, in case any of you are wondering. I was talking about bags of shit earlier on, so I thought, to balance things out. Nothing's coming up on scans or blood results. That's the whole point of fibromyalgia. You're not going to be able to detect it with a test. So it is purely your experience that will determine the diagnosis. Obviously, we have to exclude other things, but once we've excluded other things, then we need to base it on your symptoms and the signs that we get when we examine you. And once upon a time, you had to press on these specific points to, make a diagnosis. You don't have to do that anymore. So there is diagnostic criteria. This has fibromyalgia has its own code, medical code. It's a formal diagnosis. It's not like one of those ones that people made up. It's not, no matter what people say to you. So like I said, the volume control is on high, therefore regular sensations get turned up into pain, right? Everything is loud, even the most regular of sensations. And we call this central sensitization. Central meaning it's happening in the brain and the spinal cord. But you also can get peripheral sensitization. So if you have tissue injury, you sprain something, or you have arthritis, or you have repetitive strain, or you have an infection, or anything that's causing inflammation in the body, acute inflammation in the body, that will also sensitize you to pain. So that's often why people will get a flare up, because they have this central sensitization and then something comes along and basically assaults the body in some way, and that turns the pain up even louder. You can get peripheral sensitization, which is physical sensitization. You can also get emotional sensitization. So stress, low mood, anxiety, things like that can also turn the pain up, interact with the central sensitization. So a lot of people with fibro will find that when they're having a particularly difficult period, they're going through a period of grieving, or they're having a very stressful time at work or something like that, that can also turn the pain up. And these will often work in combination with with each other, with all three at all times. And sometimes the peripheral sensitization is long standing because it turns out, you have arthritis in your knee and that's not going away. So you've got that, which is sensitizing your body in general to pain. So not only do you have the knee pain, but you also have widespread pain. Remember, fibromyalgia is chronic widespread pain. It's the widespread that's important. Now, for those of you who are like, okay, that's great. Now what? What do I do about it? I believe when it comes to chronic conditions like this, that really understanding your condition is the first step to managing it. If you don't understand what's going on, it's very difficult to manage it. And you assume that your doctor understands what's going on. And I think that's a bad assumption to make. You know what happens when you make assumptions? You make an ass out of you and your doctor. So please don't assume they know what they're talking about. It's important that you do. For those of you who are keen to find out more, I have a masterclass that I've done. I'm very proud of it. We had a really great discussion actually, where people really brought some very thoughtful questions. I've covered the full gamut. I've explained everything. I've got all the recent evidence, what it shows, what you can consider taking, even in terms of medical treatment, non-medical treatment, etc., etc. So I'll link it to the show notes. It's something you might be interested in. For those of you thinking, why won't you tell us all of this stuff now? Because it took me weeks to research. And so, yeah, if you want more information, you have to pay me for it. Sorry, not sorry. After that lovely discussion about Harper, I hope you enjoyed it. I think I want to move on now to everything you've been told about weight loss is a lie. My regular segments on this show now. In fact, so regular that last week we started a topic that we're continuing this week. I mean, you've made it when you're kind of on part two of your segment. So if you remember last week, if you didn't listen, you have to go back and listen now because I'm not repeating it. We were looking at a study called Long-Term Effects of Dieting. Is weight loss related to health? And this is by Tomiyama, Alstrom, and Mann. It was published. When was it published? I wrote it down in 2013. So it's been around for a long time now. That's over 10 years. So last time I talked about the exclusion and inclusion criteria, what they were looking at every single study that exists on the planet so far. But obviously, when we do literature reviews, systematic reviews like this, we have to have inclusion and exclusion criteria. And I talked about what they were last week. I'm going to tell you what they found. I'm just going to be quoting, so I have to read. They found, and I'm sorry about this, but there is some stigmatizing language, which is such a shame because even the people who are working on weight stigma use stigmatizing language, which really fascinates me. But there you go. Only 5% of O-word dieters succeeded by the definition, and the definition was that you were able to sustain weight loss for over a year. Now, this quote comes from a study from 1959. 1959. Over the next 30 years, reviews of diet studies showed that individuals tended to lose an average of about 8% of their starting weight on most diets in an effort to create a more achievable goal. But without any particular medical reason, researchers lowered the standard to just 5%. Sorry, I think I got this wrong. The only 5% of people was more than 10%, I should say. We'll put that to one side because I'm not quite sure that I've copied and pasted and missed a few keywords from a sentence. But anyway, the point is that once upon a time, in order to be considered healthy, they say you need to lose weight, and you say how much, and they say, well, to get to a BMI of 25, and that could be like 200 pounds, which is ridiculous. It could be like 30% of your body weight. They don't care. They're like, yeah, do it. And then they dropped it to 10%, and then eventually they noticed that that wasn't going to be possible. So for no particular medical reason, I think it was in 1996, they dropped it to just 5%. That was how much weight you needed to lose, the recommended amount of weight you needed to lose in order to improve your health, but for no particular medical reason. So looking at all of the studies, they found minimal improvements in any health outcomes, and none that correlated with weight change. So obviously, whatever the study was, maybe it was dieting and exercise, maybe it was dieting alone, maybe it was exercise alone, it doesn't matter what it was, but it was with the purpose of weight loss. The purpose of the study was you were going to lose weight. And they didn't see really any improvement in health comes, but all of the improvements in health comes that they did see were not actually related with weight changes. So it was clearly the interventions that were doing the trick, not the actual weight loss. They found possible links between weight loss and a reduction in hypertension, which is high blood pressure, and diabetes medication use. So high blood pressure and diabetes medication use. They didn't see an improvement in outcomes, but a reduction in the amount of medications you'd need to take. And they also found a possible link between weight loss and stroke incidence. But when they did correlational analyses, they uncovered no clear relationship between weight loss and health outcomes related to hypertension, diabetes, or cholesterol. So whilst they found some studies that showed this, that, and the other, when they actually did their own correlation analysis, correlational, never mind. When they did their own analysis, they found no clear relationship between weight loss and health outcomes related to hypertension, diabetes, or cholesterol. And so that calls into question whether weight change per se has any causal role in the few effects of the diets. And they said increased exercise, healthier eating, engagement with the healthcare system, and social support may have played a role instead. So the question we asked was, is weight loss related to health? The answer is no. No, it isn't. That was pretty convincing study to support that argument. Last but not least, we're on to the Ask Me Anything portion of my podcast. If you've stuck around this long, thank you. And if you have your own question, please email me. Stick it at the bottom in a comment at the bottom of the YouTube video. Message me on Instagram. I don't know. Find a way to ask me the question. I'm really interested and I really like answering your questions. This was from a very sort of well-known client and community member of mine whom I've known for a long time, and they asked, what is the role of glucosamine sulfate in osteoarthritis? So I had apparently done a post on this, or maybe it was a podcast or something, and they'd heard me say, oh, glucosamine can prevent arthritis, and they were like, whoa, is that true? So I'd like to tell you where I got that information from. The study is called, again, warning, a bit of stigmatizing language here. The role of diet and exercise and of glucosamine sulfate in the prevention of knee osteoarthritis. Further results from the prevention of knee osteoarthritis in overweight females, or proof study. God, how we love to do that. It's embarrassing. It's like worse than a dad joke. It makes me cringe. But there you go. This study took 400, is a randomized controlled trial, so it's pretty good. It took 407 fat women between the ages of 56 and 60 and followed them up for 2.5 years. I really like this study because it's randomized controlled. So that limits the amount of bias that you're going to see. It took a decent number of people, 407 people. It has a control group that is neither on diet or glucosamine, which is very important. They're just minding their own business. And they followed them up for 2.5 years, which is a decent amount of time, right? Because with diet and exercise, the first year is not very reliable. The second year is when we start to see weight creep back on, and often when things change. So 2.5 years, that's a good amount of time. They compared glucosamine 1.5 grams, so 1,500 milligrams a day, and with a diet and exercise program and with control group. And they found that glucosamine sulfate significantly decreased the risk of developing knee osteoarthritis by about 60%. That was the odds. The odds ratio was 0.4 something, 0.41. That's really impressive as far as I'm concerned. I was like, hang on a second, glucose, I don't think it's even that expensive. You can get it from any health food store. Why are we not telling everybody to take glucosamine, especially fat people between the ages of 50 and 60, which was the group of people that we were talking about, but maybe younger. I mean, we can extrapolate that if it works when you're 50, it probably works when you're 40 as well. You I wish someone had told me that. So I'm going to start taking glucosamine, folks. And I encourage you to consider doing that too. You can buy it in combination with chondroitin, I think, but you can just get it on its own. And the study wants you to use 1.5 grams. That's usually it comes in 500 milligram capsules, so you need to take three. But yeah, there you go. And I just want to point out, conversely, by the way, there was no decrease in the risk of osteoarthritis with a diet and exercise program. Shocking. Diet and exercise does not prevent arthritis of the knee. Glucosamine does. But what about load on the joints, people? Load on the joints. Haven't you heard of load on the joints? Mm. Okay. I think I'm done ranting for the day. And I need more water and I've run out. I have a guest coming on, hopefully next week. There have been some, we've had to cancel a couple of times because for reasons that are not relevant to you. So I'm hoping we'll have a guest, but I don't want to promise one and not deliver. So fingers crossed there's a guest for episode 8. I hope you've enjoyed episode 7. Don't forget about my fibromyalgia masterclass. Don't forget that if you want to be able to ask me questions about your health in the same way that this long-time listener asked me about the glucosamine, the place that they asked me about the glucosamine was during clinic hours yesterday as part of the waiting room. So with clinic hours in the waiting room, I pitch up on Discord. I pop myself into the Discord voice chat. And you can just drop in anytime during clinic hours and be like, "Hi, Ash, I've got a question for you. Any medical question you like. Oh, I need help, advocating with my GP who's ignoring me. I want some advice about this. What do the studies say about this? Any question that you have. And if you can't make it live, it's not a problem. Because anytime during the week that you have a question, you can just put it into the chat and I will answer it during clinic hours. And if you don't want other people to see it, that's all right. Don't worry. Send it to me as a private message. I will respond privately. I will not respond publicly if you want it to be private. So we do that. It's called clinic hours. It's part of the waiting room. The waiting room is my online community that it takes place over Discord. It's a fantastic community. I cannot praise this community enough. They've got me through some very dark times. You can join for only £15 a month. Yes, it is a paid community because I want people to appreciate it, and also I want to prevent horrible people from joining it. And the one thing I know is horrible people do not pay to join my community. They'll come for free and cause and terrorize people, but they won't pay because horrible people tend to be stingy. So that's why I do it. If you can't afford and you really, really want to join, let me know. Otherwise, not that I have any scholarship places available at the moment, so I should point that out. They're already full, but maybe there'll be some generous people out there who want to pay for a scholarship place. I don't know. You never know. Join me in the waiting room. Check out my fibromyalgia masterclass. Don't forget you can book a consultation with me anytime you like. If you're listening to Harper's story and you're thinking, that's me, I'm Harper, I don't know what to do. I've tried my best. I'm not getting anywhere. Book a consultation with me. I'll help you. I've helped a lot of people like Harper. Not to toot my own horn too much, but I'm a bit of an expert. So yeah, come find me. Thanks very much, folks. I will see you next time.